Hi everyone, and welcome to the 43rd episode of Battles and Voices. I'm Latika, and I'm the founder and host.
And I'm Camden, and I'm the co host, and we serve on the executive team of Vitals and Voices.
Battles and Voices brings together generations of people involved in healthcare in order to foster a supportive community.
Now, please welcome our guest, Dr. Montai.
Dr. Monti, thank you so much for being a part of this episode. It means a lot to us that you'll be one of our guests today on Battles and Voices. Feel free to kind of introduce yourself and share some things about yourself as well.
Yeah, definitely. Thanks so much for having me, Lathika and Camden. My name is Dr. Megan Montai. It's a really hard name to say. I'm a board certified family doctor, and I'm also the founder and owner of Heirloom Family Medicine, which is a direct primary care practice here in Albany, New York. And I opened the practice in September of 2025, so it's kind of new. It's kind of exciting. But probably more importantly, I'm a wife to Phil. I am a mom to two super cute, super awesome boys, Miles and Henry. I'm also the daughter and granddaughter of South Korean immigrants. I am what I call an endurance sport junkie, and I'm also a Swiftie.
Oh my gosh. So, thank you so much for giving us that little introduction about you. And can you tell us a little bit about what inspired you to go into healthcare and a little bit more about Heirloom Family Medicine?
Yeah, definitely, definitely. So, when I was in high school, like you guys, I decided that I wanted to be a doctor, and I knew that I wanted to be a primary care doctor from the get-go. But my path to direct primary care and entrepreneurship has been relatively new. So as you know, the path to medicine is kind of long. You know, you go through undergrad, you go through med school, you go through residency after that, and my first job out of residency was being an outpatient family doctor at a clinic that was owned by one of the largest healthcare systems in the area. And my first job was great. You know, I love my patients, I love my coworkers, I love being a family doctor, but just with all of like the barriers and kind of craziness that goes along with insurance-based medicine, I grew pretty like disenchanted and just discouraged by having to do more and more do see more patients with fewer resources and just less time, and it felt like less support in general. And so, in response, I decided to open my own direct primary care practice here in Albany. And that's been a new venture for me since the fall. And it's really just allowed me to be able to care for my patients with more connection, presence, and heart. And I'm having a lot of fun in the process too.
I really love that story, and congratulations again
Thank you.
for opening your own private practice. That's really awesome and a big step.
Yeah.
So, a little bit more into your private practice. Could you tell us more about some of the challenges that you face when founding your own private practice, Heirloom Family Medicine?
Yeah, so there's a lot. I think, in going through med school and training and everything, you learn a lot about how to be a doctor, but you don't learn a lot about the business side of medicine. And so that has been a pretty steep learning curve, just trying to figure things out as I go. I'm lucky that my husband is also a small business owner. He's an attorney, and he has had his own practice for a while. He works with his father as well, too. And so he's been a really good resource for me to just ask a lot of questions to and learn from as well. But there's also a lot of folks in the direct primary care community, other doctors who have been really willing to offer their advice and share any insight and guidance to kind of help other doctors who are in an earlier stage to kind of go along as well. I think the other things that have been really challenging with opening my own private practice, leaving my patients was really hard at first. So I was at my job for like 4 years. And even though 4 years isn't like a long period of time, as a family doctor, like you really get to know families inside and out. I always think it's like such a privilege that patients will sometimes tell you things that they don't even tell their spouse or they don't tell their kids or anything like that. And when you walk through really tough times with patients and also really happy times with patients as well, too, you develop really strong bonds with them. And so having to leave my patients was definitely a really big hurdle for me to get over. But I've been also really lucky that some of my patients have chosen to follow me to my new practice as well. And regardless, I think like my patients who haven't decided to follow me, I think that they've had they've wished me, good wishes and well wishes as well with my new venture as well. And then the last thing is like direct primary care is kind of like a new concept. Most people are used to paying for their healthcare needs with health insurance. And so just trying to describe to people how direct primary care is different, how, we bypass the insurance system as well too, has been a really interesting experience. Some people like get it from the get-go, and other times people have a lot of questions, like understandably so, because it's kind of like a new concept as well too. But the challenges are definitely worth pushing through because I'm definitely building something that I think is really making a big difference for my patients and my community. And it's also allowing me to care for my family in a much more fulfilling way.
Well, that is incredibly beautiful, and you're doing a lot of meaningful work with that. And could you share some important aspects of direct primary care and why it matters so much to you?
Yeah, yeah, definitely. So, for your listeners and you guys, if you're not familiar with direct primary care, so we kind of call it like a Netflix membership or sort of like a gym membership, but for healthcare. And so it is where patients pay their doctor a transparent and affordable monthly membership fee. And in exchange, they get direct access to their doctor. They get enhanced access to their doctor as well, too. And because DPC operates outside of the traditional healthcare system, I'm able to offer my patients a lot of things that they can't get from their insurance-based doctor. So that can mean longer appointment times. I spend 90 minutes to 2 hours with my patients when they first establish with me. My other appointments are anywhere from like 30 to 60 minutes long. I'm able to offer same next day access for visits as well. My patients text me, which is like really, really convenient and awesome. And I feel like I'm a millennial and I like to text, and my patients like to text me back, which is cool too. And then like the other things are just having a real relationship with your doctor as well too. We have a lot more time to just kind of delve into things, get to know one another, follow up on things as well, and just kind of relate as human beings, not just as like patient and physician. And the other cool thing is really, it sounds kind of counterintuitive, but DPC can actually save patients a lot of money in the end too.
That's really meaningful to hear, and I really love the relationship that you have with your patients. It sounds so meaningful as well, again.
Yeah, yeah, it's super cool because there's some patients that followed me for my last practice, and I thought I knew
Hmm.
them really well, but like this year, I sent out my Christmas card to my family's Christmas card, like with our pictures and everything to all of my patients, and I slowly started to get like
Oh,
some from other ones as well, and I was like, oh, I knew you had a son, but like now I know what he looks like. Like it's just really cool how patients, I think they want to know their doctors on a human level and, vice versa as well too. And DPC really allows us like the time and space to be able to get to know each other in that way.
definitely.
Again, that is so beautiful. And I I honestly never heard of that either before myself. But again, that is really beautiful. And can you explain a little bit about your educational background that led up to now having your own private practice?
Yeah, totally. So, just kind of like my background through school and everything. So I did 4 years of undergrad. I went to Siena College, which is now Siena University, which is in upstate New York, just outside of Albany. And then after that, you have 4 years of medical school, which the first 2 years, it's a lot of time in the books. It's not my favorite time of my life, because you don't really get to talk to patients. You're just kind of studying and taking exams and different things like that. And then the next 2 years are more kind of clinical rotations where you're rotating through all the different specialties, a lot of inpatient rotations, outpatient rotations, lots of early hours and late nights as well. And then after that, I did 3 years years of family medicine residency, and those are both at Albany Medical Center. And I chose to stay in the area. My husband is from the area as well too, so we kind of won that argument. But it's a really great community to live and work in.
That's really wonderful. And I know I wasn't able to ask this, but what's the most unexpected thing you've learned about your profession?
About my profession or about direct primary care?
Both, honestly,
Both
if
of
you want
them?
to. Yeah.
Yeah, yeah. Um, about my profession, I don't know. It's kind of just, I think it's just such a privilege, the things that people will share with you, kind of like what I said before. Um, I think it's pretty cool that you get to be able to celebrate with patients like through some of the most exciting parts of their lives, like delivering babies and welcoming that new family member to the family as well too, but also talking with families about very vulnerable things that they really keep to themselves, like drug addictions in the family, or grief for really serious like mental health problems as well too. I think like with direct primary care, I think one of the things that I wasn't expecting was, because I can take care of patients with like any type of insurance or even no insurance. I've had a lot of people who don't have health insurance who have really been interested in my care and this model of care. And it's been really cool to care for a lot of small business owners who haven't been able to like afford health insurance off of the marketplace, or haven't been able to justify spending like tens of thousands of dollars each year on health insurance. And these are like really hardworking people. They're smart people. They're people who are making really significant impact on our community. And I think it's been really cool to just be able to care for this population of small business owners who haven't been able to have really great access to healthcare because they haven't been able to get insurance. And so family medicine, it's like not a super glamorous specialty, but there's definitely a lot of really wonderful aspects to it.
I love that. And do you have any stress relieving techniques that you use when you aren't having the really best day, or even when you have a hard time at work?
Yeah, definitely. So I joked about it before. I'm like an endurance sport junkie. So I ran cross country in college. I've been a runner like pretty much since I was in high school. And I'm a really big proponent of just moving your body and exercise for, not only physical health, but also mental health and social connection as well, too. So I was a runner in a past life, and then I kind of dabbled in like triathlons for a little bit. Now I just do like Orange Theory and stuff, but that is like a huge stress relief for me, and probably like my favorite time of the day.
I love going to the gym too, and I find it as a like stress reliever too. But I can't say I use Orange Theory. I've been a user of Planet Fitness and my
Yeah.
black card there and my
I know.
little
I
black.
feel like my fitness journey has like evolved for sure, but I think it's good that you guys are like in high school and already seeing the value of that. 'Cause that's important.
And I also just use the treadmill as well to just look at my slides. I do say that though. Um, and then could you explain and also clear up any misconceptions that people may have regards to cash pay medicine?
Yeah, yeah. So I had to face this head on because I had an Instagram reel that went viral, which I was not expecting it to. I think that's how you guys found me probably. But I think I just want to share with your audience that cash pay is not a dirty word. I think a lot of times when people hear cash pay, they start to think like things are kind of sketchy, or there must be like a catch associated with it as well. But I think um, you know, in the video, I talked about how DPC doctors, although we don't accept health insurance, we're able to care for patients who are uninsured, underinsured, and patients who feel like dismissed and forgotten in the traditional healthcare system. And so, like, my patients have all types of insurance. They have no insurance, they have Medicare, they have Medicaid. They represent like all different walks of life as well, different socioeconomic statuses. But the one thing that they have in common is that they really value their health enough to invest in it, and they really value that relationship with their doctor. And I got a lot of heat about cash pay doctors trying to be like money hungry and different things like that. But I think just with the way that insurance plans are going, the premiums are going up, the deductibles are going up, DPC can actually save patients money. And I guess I just want to challenge folks to think outside of the box and think a little bit differently as well too. If we cut out insurance companies, if we cut out corporate healthcare systems as well too, it's like actually shocking how affordable healthcare can be. And so DPC doctors are not grifters, even though we're, cash pay doctors as well too. I think DPC doctors have probably like the biggest hearts as well. And a lot of times DPC doctors will also provide pro bono or sliding scale memberships to patients as well too, just to be able to improve access even more. And that's something that I'm looking into providing in my community as well, as my practice grows and matures.
That's amazing to hear again. And besides running and cross country, do you have any other hobbies outside of healthcare or your work that really help you be better at your job mentally and physically?
Yeah, that's a really good question. I feel like my hobbies right now are very slim just because I have two small children, but I honestly just like spending time with my family. It's been really cool bringing the boys along and just kind of like having them experience our hobbies and the things we like doing and seeing things through their eyes. So like earlier today, we took our 3-year-old skiing, and he had a lot of fun, I think. I mean, he we stayed out for like a couple of hours as well, but things are pretty busy right now, like with the business and work and the kids and stuff. But when we can, we try to get out for walks and just try to stay as active as possible.
That's adorable. And I recommend trying pickleball, especially with a family of four. You can fill up all the little squares to play
Yeah.
like a good game.
Yeah, pickleball I feel like is just like has swept the nation, and I've played it once, but I don't know the rules well enough, I think, to like actually play it like with my family. So I'll have to find like an experienced pickleballer to teach me
Oh
their
my gosh. I
way.
absolutely love it. I used my junior year, I used to play every single day after school. Because it was really close to campus, and I just kept like a pickleball like racket in my car, and then the balls too. And I just texted my friends, "Hey, so we're meeting up after school," and they're like, "Yep." And it's definitely, I love it. It's a fun sport, and it's really competitive.
Oh, that's awesome. That's awesome.
Gotta let me know if you ever try it.
Yeah, for sure.
Now, is there anyone in particular that has given you motivation to come this far into your private practice?
I think it's mainly, I think I'm doing it for my patients. I saw how the traditional healthcare system can be really dangerous in general with like rushed visits and poor follow-up. And there's just a lot of opportunities for mistakes. And I just think our patients deserve more than 7 minutes in the office. And I think my family as well too. And that's my husband and my kids, but I think also my parents and my grandparents, and just all of the sacrifices they've made to give me the opportunity to be able to pursue this career as well too. I'm just really thankful that to even be able to have open to practice like this, because I think it's been really really fulfilling, and I just feel really grateful for the opportunity.
Really love that. And lastly, to wrap things up, do you have any advice to give to any of the listeners listening right now, hoping to either go into family medicine or even starting up their own private practice?
Yeah, I think you have to know what your why is, and you have to believe in it like fearlessly. And I think when you know why you're doing what you're doing, it will get you through the hardest days. It'll get you through another Saturday night in the library or, another exam or another hard rotation and things like that. So, just keep pushing forward, just keep putting one foot in front of the other. And then before you know it, you'll be in your 30s with kids and having a private practice because it goes by really fast.
That is some beautiful advice, and thank you so much for telling us about your inspirations to reach this point in your career, along with the things that you believe in.
Yeah, definitely. Thank you so much for having me, guys.
Thank you
Thank
so
you.
much. And it was truly inspiring to hear about how you started your own practice to connect better with all of your patients.
Thank you.
And to everyone tuning in, thank you so much for joining us on today's episode of Vitals and Voicement. Your engagement and loyalty means the world to us.
If you enjoyed this conversation, then be sure to follow, share, and stay tuned for more episodes on Vowels and Voices.
We'll see you next time.